You're watching CTOM TV. Knowledge is power.
So one of the first questions that you asked us, Michael, really is how much can Alex or our team at Cancer Treatment Options and Management tell from a pathology report?
Mm-hmm. Great question. Yeah. So the more information we have, the better. Michael did send us a pathology report, brief pathology report, and it had a lot of really good information in it.
Okay.
So
this is for someone in his family that has cancer.
Yes.
Okay.
Yes. So for starters, it was a fairly low grade, or it was a high grade, but it didn't seem to be having a lot of spread at the time. I think it was 2 out of 22 lymph nodes were infected. None H. pylori, which is a common cause of gastric cancers. It was poorly differentiated, and it was signet ring, and both of those are they're kind of negative features when it comes to standard therapy. But one thing I did notice was something called lymphocyte infiltration, and that is a very important factor, because what that means is that it means that the immune system is actually trying to fight back this tumor. And that also brings up another important point. Now, I'm not sure if Michael is Asian or if his relative is Asian or not, but gastric cancer in Asian patients tends to respond much better to standard therapies than in Caucasian patients. So that is an interesting thing. And when they adjust for variables like diet and so on, the genetic background seems to be different. So what I would suggest, Michael, is I would suggest that you look up 2 different studies. The first one is going to be the Keynote 059, and that's where they used immune therapy, combined it with 5-fluorouracil and Xeloda and cisplatin. And then there was also the Checkmate, where they used nivolumab. It's Checkmate 649, and they used nivolumab, ipilimumab, and different chemotherapy combinations. And in both cases, if the patient was PD-1 positive, I think there was a 40% response rate versus a 24% response rate. So I think both of those trials, both of those protocols would be excellent choice, especially for elderly patients. Their immunotherapy, and any tumor in the pathology report, if it says immune or lymphocyte infiltration, that is an indication that immune therapy could be a very good important diagnostic tool to indicate that immune checkpoint inhibitors could be very beneficial.
Okay, so there's lots of information there. So in other words, you can get quite a lot from a pathology report. It sends you in a lot of directions, or lets you know what other information you need to gather for different types of tests and research. Yeah. Michael's let us know his mom is Korean.
Okay.
Yeah.
Okay.
Yeah. So there you go.
The second thing I'd recommend, as always, tumor DNA sequencing. No two way about it.
Yeah.
Thank you for watching CTOM TV. Subscribe below and stay informed.